Good morning, consultants, my fellow senior registrars and medical officers. I'm Dr. Chininso and Ereke. I'll be presenting spirituality in family medicine today under the following. So, hey, I wanted to scroll down. Hey. Okay, so I'll be presenting spirituality in family medicine under the following outline: objectives, introduction, definition of terms, biopsychosocial spiritual model, spiritual care and assessing spirituality, role of the family physician, obstacles to spirituality medicine, benefits to the physician patient relationship, positive and negative impacts of spirituality on health, conclusion, and references. My objective of this presentation, at the end of this topic, we should be able to understand the difference between spirituality and religion. We should be able to assess the spirituality of a patient. We should also be able to identify the positive and negative impact of spirituality on health. We should also identify the role of a family physician in the use of spirituality in patient care. By way of introduction, in Africa, religion and medicine, they are intertwined, particularly in complementary and alternative medicine. So it is difficult to separate religion from medicine because of the African theory of illness, which attempts to explain illness and disease as being caused by spirits, with many traditional healers being religious leaders and vice versa. There is evidence these days that spiritual homes and churches are usually the first point of contact during illness for many, and second point of contact for some when orthodox medical care seems to have failed. So due to this, there is current upsurge and large attendance at crusades, conventions, healing and deliverance sessions, and some may even have request for referral with a medical report to healing homes, which is evidence of the flair for spiritual healing in illness and health. Okay, definition of terms. What what do we mean by spirituality? It refers to a belief in a higher power, an awareness of life and its meaning, centering a person with purpose in life. It involves having a relationship with a higher being, with self, and with the world around the individual. The concept of spirituality is found in all cultures and societies. It is expressed in an individual search for ultimate meaning through participation in religion or belief in God, family, naturalism, rationalism, humanism, and the arts. Then, what is religion? Religion is primarily a set of belief, will I say an organized and public belief system of worship and practices that generally has a focus on a god or a supernatural power. What are the major world religions we have? They are divided to Christianity. Under Christianity, we have the Catholic, the Presbyterian, the Methodist, the Episcopal, the Baptist. Then under Islam, which are the Muslims, we have the Shiite group, the Jibwis, the Dari. Then under Judaism, we have the Reform, Conservative, and Orthodox. Then Hinduism and Buddhism. What is the difference between associating spirituality with religion? Like I earlier said, spirituality is often associated with religion, and while they overlap and can interlink, the two are not synonymous. So a person may be deeply spiritual, but without any particular religion. So in that, what I mean is that someone can be spiritual but not religious. Someone can have the both, while someone can be religious but does not believe in any supernatural being. That's he's not spiritual. He's not spiritual. So religion is a specific set of organized beliefs and practices. This is usually shared by a group, while spirituality is more individualized. It has to do with a sense of peace, purpose, and connection to others. The biopsychosocial social spiritual model of care. This model of care was proposed by Angel and White in 1976 and was extended to encompass the spiritual by Daniel Sumasi in 2002. This approach is based on the concept of a person as being in relationship. It also deals with disease is said to be disturbance in the right relationships that constitute the unity and integrity of a human being. So according to this biopsychosocial spiritual model, everyone has a spiritual history. Usually when one encounters a life-threatening illness, it involves a person in his or her totality. This totality we are talking about includes the biologic, the psychological, the social, and the spiritual aspects. So the basic tenets of patient-centered care are rooted in this biopsychosocial spiritual model. So in the initial patient-doctor encounter, the questions should be framed from the physical, the emotional, the social, and the spiritual domain. So while making your diagnosis, make sure that this your diagnosis is based on all these dimensions. Finally, the assessment and plan can be outlined for each of these dimensions. For spiritual care and assessment, general spiritual care can be defined as recognizing and responding to the multifaceted expressions of spirituality we encounter in our patients and their families. It involves being compassionate, to be present, listening, encouragement of realistic hope. General spiritual care can be provided by anyone. Specialized care often involves understanding and helping with specific theological beliefs and conflicts. It is ideally performed by persons with special training in this area, such as the clinical pastoral education, chaplains. So, spiritual assessment is the process by which healthcare providers can identify a patient's spiritual needs pertaining to medical care. What are the guidelines for physicians interested in exploring spirituality in clinical care? First and foremost, the guiding principle, you should do no harm. The purpose of the dialogue should be burden lifting, not burden producing. Secondly, the physician must be open and non-judgmental in claiming that their beliefs are personally helpful without claiming ultimate truth. Thirdly, the dialogue must be at the invitation of the patient. You as the physician should not impose the conversation. Ensure that the patient initiates it. Fourthly, the physician may enter such a dialogue, but you are not obligated to do so. What are the general prerequisites for spiritual assessment? First and foremost, you must have a spiritual self-understanding. You as a physician, you have to have a spiritual understanding and self-care. The physician too should understand his own spiritual beliefs. Yes, because you as a physician, if you don't believe in anything, you have a problem initiating a conversation with a patient about his or her own spiritual belief. So this will also help you as a physician not to be biased and non-judgmental when dealing with the spiritual concern of a patient. Okay, you should also be true when the beliefs of the patient differ from your own. You have to promote a self-understanding, a formal spiritual self-assessment using the formal tool. In other words, as a physician, you should focus on the beneficence to the patients, individualize care as much as possible, stay within the boundaries of relevance to clinical practice, be self-aware of limits of personal, cultural competency and communication, and avoid imposing of personal beliefs. Who may benefit from spiritual assessment? Older patients, patients that you have more time with, that's the inpatients, patients with end of life problems, patients with chronic illnesses or worsening illnesses, patients with mental illness, both the new and the old. Then patients who drop hints, casual remarks about faith, and then concerned voice during FIFE questions, like when you are FIFEing your patient in your history taking and the patient, his or her own voices out a spiritual concern, you should also involve such patients. Then the various spiritual assessment tools, I'm going to be dealing on them bit by bit. I'll start with the hope approach using the subheading hope, that's the H, which stands for the source of hope, the meaning and comfort, what you want to know, the source of the patient's strength, peace, love, and connection. Then you also want what is there in your life that gives you internal support. These are the questions you should be asking to find out what the patient holds on to during difficult situations. Then what sustains him or her, or what keeps the patient going. For the O approach, organized religion, you want to consider if this patient is in any part of any organized religion. How important is this to the patient? What aspects of religion are helpful and not helpful? And you also want to know what part of religion or spiritual community your patient is. Then the P, personal spiritual belief. You want to understand if this patient has any personal spiritual belief that are independent of an organized religion. What do you believe in God? What kind of relationship does this patient have with God? Then for the E, the effect on medical care and end of life issues. You want to know if being sick has affected this patient's ability to do things that usually help him or her spiritual in his or her spiritual life. Then as a doctor, is there anything you can do to help assess the resources that usually help? You also want to, you are worried about any conflict between your beliefs and medical situations. Then you also want to know if the patient is dying, how do your belief affect the kind of medical care that you would like you would like to provide this patient with. The FICA assessment tool. This was developed by Dr. Christiana Puchelski. She's an executive director in George Washington Institute for Spirituality and Health. So this FICA tool was effective in assessing several dimensions of spirituality based on correlation with spirituality indicators in the quality of life. So using the um, FICA subheading, the F stands for faith and belief. You want to know if this patient has any spiritual belief and what kind of belief helps him or her to cope with stress. If the patient responds no, you as the physician might also ask, what gives your life meaning? Sometimes patients respond with answers such as family, career, or nature. Then the I, the importance, you want to know the what importance does your faith of belief have in your life? Because this could also influence the kind of care you will be giving this patient. The C part, the community, you want to know if this patient is part of any spiritual or religious community. Then the A, address in care. How would you like me as your healthcare provider to address these issues in your healthcare? The Magun spiritual assessment tool. This deals with the acronym SPIRIT. For the S, the spiritual belief system. The P is the personal spirituality. You want to know what this patient believes in. this is individualized. Then the I, the integration within a spiritual community, you want to know if this patient is in any organized religion. Then for the R part, you want to know if this patient is involved in any ritualized practices and restrictions. Then the I, the implication it has on this patient's medical care. Then the T, for terminal event planning. The next spiritual assessment tool we'll be talking about is the ACP spiritual history tool. Here it deals with questions, the faith of the patient. You want to know how important the patient's faith is to his or her illness. How has the faith been important at other times of his life? Do the patient have someone to talk to about spiritual matters? Would you also like to explore spiritual matters with, you want to know if the patient would want to discuss his spiritual ideas with other member of the family? The Kuhn spiritual inventory. This comprises of 5 belief and faith questions, which includes: what things do you believe in or have faith in? Has this illness influenced your faith? How do you exercise faith in your life? How has your faith influenced your behavior during this illness? And you also want to know, what role does your faith play in regaining your health? The Matthew spiritual history assessment tool. This deals with whether your religion or spirituality, is it important to you as the patient? You also want to know if his or her religious or spiritual beliefs, has it influenced the patient's belief or the way he looks at the medical problems he or she is having at the moment. Then you also ask the patient, would you like to address his or her religious or spiritual belief and practices together? Then the open invite assessment tool. This particular tool is a patient-focused approach to encouraging a spiritual dialogue. It is structured to allow patients who are spiritual to speak further. It's also allowed those who are not to easily opt out. The first thing, it reminds the physician that their role is to open the door to conversation and invite the patient to discuss their needs, preaching or prescribing spiritual practices. The second thing you should have at the back of your mind is that this open invite provides a mnemonic for the general types of questions a physician may use. Questions asked are similar to the ones we used in the Fika and Hope mnemonics. Example: may I ask your faith background, or do you have a spiritual or faith preference? Then the invite questions are usually used to encourage patients to discuss their needs as their comfort allows. So we'll talk on spiritual distress. What do we mean when we say a patient is in spiritual distress? This is when an individual is unable to find sources of hope, love, peace, comfort, strength, and connection in life, or when there is or when conflict occurs between their beliefs and what is happening in their life. This spiritual distress has potential triggers, such as after a trauma, when bad news is broken, when a situation becomes life-threatening, when bereavement is experienced, and when a patient is isolated and receiving no visitors. What are the signs that you would see in a patient? You know that this patient could be in spiritual distress. Weeping, tearfulness, patient may be asking, why me, repeatedly. Withdrawal or lack of interest, restlessness, complaining, sudden religious leanings or abandonment of previously held beliefs, fear of being alone or falling asleep. The patient too can feel guilty, also will be anxious about hell or afterlife. What is the role of a family physician in spirituality? Family physician must maintain a balanced and open-minded approach to medical care without sacrificing scientific integrity. The physicians can incorporate spirituality into medical practice in 3 ways: by scientific study of the subject, by assessment of the patient's spirituality and diagnosis of spiritual distress, and by therapeutic interventions. The physician should keep an open mind and be aware that there are some things that may never be fully understood. For assessment and diagnosis, the physician should evaluate whether spirituality is important to a particular patient and whether spiritual factors are helping or hindering the healing process. Impact of spiritual assessment on medical management. There are no clear answers to questions raised. Um, incorporate spirituality into preventive. It incorporates spirituality into preventive healthcare. Example, prayer. Some patients you find out that they need meditation, yoga, walks in the country. We also include spirituality as a complement or adjuvant. Example, standard medical care plus suitable spiritual ritual acceptable to patients. You can also modify treatment plan. Yes, it can help you modify treatment plan as a patient's spiritual needs unfold. What are the obstacles to spirituality in medicine? Number one is scientific reductionism. This denies the existence, transcendence, and the spiritual nature of human reality. Then the negative public impression and attitude towards religion and spiritual beliefs. Also, the industrialization of medicine. It reduces it to an economic enterprise primarily concerned with efficiency and financial gain rather than the compassion and treatment of the whole person. What are the benefits to physician-patient relationship? It helps you assess and integrate patient spirituality into the healthcare, and this can build trust, rapport, and broadens the physician-patient relationship. It also improves adherence to physician-recommended lifestyle changes. The assessment too helps patients recognize spiritual or emotional challenges that are affecting their physical and mental health. For physicians, incorporating a patient's spirituality brings the potential for renewal, resiliency, and growth, even in difficult encounters. Sometimes we physicians, we have few medical solutions for problems that cause suffering, such as incurable disease, chronic pain, grief, domestic violence, and broken relationships. In these situations, providing comfort to the patient can increase patient satisfaction. Positive impact of spirituality. It gives you a more positive outlook on life. There is better quality of life. It helps your patient cope better with the disease. It also helps the patient face death, especially in terminally ill patients that get to die. They get to die a good death. It also receives comfort for religious beliefs in bereavement. On recovery process, spirituality enhances recovery from illness and surgery quicker than it should. Such patients too tend to have higher self-esteem. They are also less anxious, and spirituality enhances power of hope and positive thinking. It also improves a better health outcome. What are the negative impacts of spirituality on health? The harmful effect occurs when they encourage excessive guilt, fear, and load self-worth. There is also sometimes acts of deliverance from demonic attack may result in head injury or fracture when the individual is made to fall under the spiritual power. It also limits acceptable treatment options. In conclusion, it is very important to consider spirituality as a potentially important component of every patient's physical well-being and mental health. Addressing spirituality in your initial assessment, continue addressing it as a follow-up visit if appropriate, is also key in improving best healthcare to patients. Nevertheless, it is equally essential to respect patients' privacy regarding spiritual beliefs and do not impose your beliefs on others. Thank you. These are my references.